Thank you, Octavia. Next up is Camilla.
Good afternoon, everyone. My name is Camilla Zumaeta, and my title is The Importance of Content Diversity in Dermatological Practices. Before I begin this research, I would like to give a thanks to the Cook Center for this amazing opportunity, and a thanks to the faculty and staff for this lovely experience. So, the importance of content diversity in dermatological practices. The lack of content diversity taught in American med schools can impact patients' health. Dermatology is no exception, since research indicates that most textbooks lack diversity in their content. This lack of diversity causes for an example of this lack of diversity is non-inclusive training for future dermatologists and insufficient research to treat diverse bodies of patients. In the dermatologist field, there are 64% of white, 18% Asian, 9% Hispanic or Latino, and only 4% Black or African American. This is one of my examples of how the same skin condition can look different based on the skin tone. So this is COVID feet, one of the symptoms from COVID. And as you can tell, the symptoms shown are different. So because of this, my research question is, how does the lack of diverse images in textbooks impact how dermatologists effectively treat diverse patients? The lack of diversity provided in the content leads to a higher likelihood of delayed diagnosis or misdiagnosis regarding skin conditions. Terminology. For this research presentation, it is important to know what I mean by inclusive training and health disparities. Inclusive training refers to the dermatologic textbooks, and the health disparities is racial gap and rates of health in various components. Methodology. During my research, scholarly articles and journals were found through Duke Library and Google Scholar. The primary disciplines examined were dermatology, sociology, internal medicine, and health disparities. Analysis and data findings. Misdiagnosis. The cause for the lack of diversity within the textbooks causes for misdiagnosis and therefore leads for dermatologists to have issues with diagnosing skin conditions. One of my first examples are psoriasis. As you can tell on the left, psoriasis is shown on a darker skin patient with purple hues and bumpy skin, and on the right side, it's shown with red hues, dry and flaky skin. Another example I have is vitiligo. On the left, you can see it's on a white patient's skin, and on the right, on the top, it is shown on a darker patient's skin. In the middle, I have an example of tinea vesicolor, another skin condition that is commonly mistaken for vitiligo within darker skin tone patients. Another example I have is eczema. On the left, reddish hues are shown, and on the right, there are brown, violet, or ash gray hues. Textbook content. Within these textbooks, a lot of lack of representation for diverse skin tone images are shown. Not only are there lack of representation within these textbooks, but there are stigmas within these textbook pictures. The images that are shown of darker skin tones within these textbooks are mainly of sexually transmitted diseases and infectious diseases, with having 0 images of common skin conditions such as psoriasis, vitiligo, and eczema. Patient outcomes. Treatment biases. Black and Latino children are less likely to receive fewer bacteria diagnoses than white children. Women of color are less likely to be asked about their family history of breast cancer. Skin cancer for individuals with darker skin tone is deadlier from the delay of diagnosis. So the limitations found in this article when doing this research was having limited access to the dermatologic textbooks, and the study does not explore the impact of these images in other medical disciplines. Suggested future research. Bring awareness, educating. We should better train working with diverse patients, inclusion, more doctors of color, and faculty recruitment, which is including more diversity within the faculty. So one of these examples of someone making a change within this issue is a medical student in London who decided to create his own handbook for physicians about skin conditions with the Black and brown community. So if there are any questions, and I can answer them right now.
Is there any difference in the textbooks that are used at traditionally African-American medical schools, such as Harriet, Morehouse, that would highlight the differences in these different diseases, these skin tones, or do they use traditional textbooks?
They use traditional textbooks, but the last example that I showed was of only diverse images. Are there any other questions? That's it.